Dr. Hannah Bobert, one of the volunteer doctors, visited Zambia and had an opportunity to visit Momboshi Health Post in Chisamba district of Central Province. Momboshi Health Post is located about 26 kilometers away from Chisamba town. The objective of the visit was to enable the doctor to have a clear view of where the cases reported on the Virtue Doctors app come from and to appreciate the kind of medical care service our patients are receiving at the health post. It was quite a busy afternoon for the two clinicians attending to an average of 80 patients per day. In view of this, the situation clearly shows how much support frontline staff need to serve patients in their facilities. The clinicians explained the process of how their facility operates.
A complicated pregnancy. Yeah. We have to usually tell them or rather encourage them to
go there in advance. Yeah, exactly. Yeah.
Just as they come here, those from far places, we really encourage them to come and deliver. Come and wait to deliver for them.
Okay. You have to try and prepare basically in advance. Yeah.
Definitely.
Are you able to do any surgery here?
No.
You don't do anything like that?
No.
Okay. Yeah, you won't be able to.
But we have an obstetric scan.
Okay.
Yeah, just basic obstetric scan.
Yeah,
we do that.
Okay.
Yes. This is able to show us the position of the placenta.
Okay.
Yes.
Yeah.
As well as basics.
Okay.
Dr. Hannah and the Virtue Doctors team toured all the departments at the facility, and the clinicians explained to the doctor some of the challenges that they are facing with their equipment.
That's the baby?
Yeah.
Ah.
It's not working.
And what's that?
So this one?
Yeah.
It's an autoclaving machine. But
Auto-
it's down as well.
It's sterile? Ah, okay.
This one is an oxygen machine. It's not
Yeah.
working.
It's not working. Yeah, all of this is broken basically. Can you get it fixed? You can't?
Yes.
You can?
Yes.
You will get it fixed?
At the moment, we don't have the capacity.
Yeah, that's the same.
Yeah.
Exactly.
Yeah, but we would love
What is this
to
exactly?
have it fixed.
What is this? Just a heater? The baby?
Yes.
And the Virtue Doctors service is providing the much needed support in mitigating some of these challenges. However, the visit helped the doctor to gain a deeper understanding of the best ways to offer advice on prescribing medication and treatment options. The clinician then introduced one patient who recently consulted on the Virtue Doctors app. The patient has a skin condition which has persisted for over a year now. The volunteer doctor advised the clinician to consult further on the Virtue Doctors app to find a lasting solution to the condition.
The Virtue Doctors interview. My name is Penelope Chileche, and here with me I have two gentlemen from Momboshi Health Post. Welcome to the interview.
Thank you.
Please just introduce yourselves, tell us a bit about yourselves.
Okay, I'm Banda Thompson. I'm a nurse at Momboshi Health Post. I've worked under Ministry of Health for 4 years, and I joined the Virtue Doctors about 3 years ago. And on my everyday activities, we do screening people in OPD, MCH, we see them for antenatal and other services, ART and so on.
That's quite interesting. Please go ahead.
Yeah, basically, my name is Joseph Banda. I'm a clinical officer general here at Momboshi Health Post. Yes, and I'm also the facility in charge. Yes, basically I've been with the Ministry of Health for the last 4 years. Yes, and basically my everyday activity is generally, I'm in all the departments, yes. But to be specific, I'm a clinician. So I'm involved in the screening of patients, yes. And apart from that, that's under OPD, yes. Under MCH, I also offer other services such as antenatal. Then we also have ART, yes. I think basically that's that.
Alright, quite interesting. Okay, so you mentioned that you're found here, that's a day-to-day job. It's like handling patients. Okay, so what are some of the challenges that you face at the facility?
Okay. I think some of the first challenges that we face as a facility is, as you have seen, Momboshi is just a small health facility, and we don't have much needed facilities such as lab for investigations. We are basically just a health post, so we just offer basic health care services. Yes, so usually the challenge that we face is we are limited in terms of the management of our clients. Yes, sometimes we might need a lab investigations. Now, us being a health post, yeah, you know, we are limited in the interventions that we do, rather than investigations.
Alright, so would you like to add anything since you also handle patients?
Yeah, in addition to what Mr. Banda said, some challenges are at our facility. We have a lot of clients that basically seen day after day, but also the issue of shortage of drugs. It's not all that adequate. Yes. And when you, or maybe you have an emergency, the distance from here to where we refer our clients is far.
Okay.
In that case.
Okay. So what are some of the problems that you encounter with like patients? What are some of the common cases? And do you have like enough medication for the patients that visit the facility?
So basically, one of the diseases that we've had, you know, we face a lot of malaria cases, of which most of them, yes, we treat them just here, except for the complicated cases. Yeah, when we have complicated malaria cases, that's when we have to refer for further investigations. But we have all the drugs. For the malaria cases, we have all the drugs. The artesunate, the coartem, yes, and the quinine. Unless where we feel there's more than just malaria that we are treating. Maybe if a client needs further investigations, especially pediatrics, where we suspect maybe it could be there's a renal failure due to that has come up because as a complication of malaria. There we refer such cases. And the other common condition that we usually face is the respiratory tract infections. Yes, they are quite a number. Yes, but we do manage to treat the cases. Those that we feel they still need further investigations. Maybe we have to order sputum, maybe an X-ray, chest X-ray, maybe gene expert and other investigations. Those are the cases that we refer.
Okay, so on an average, how many patients or clients do you handle per day?
Per day we can handle maybe 80 clients. Yeah.
Okay, so like what's the population catchment?
Population catchment area according to head count is 20,525 and the CSO is 13,508.
Okay, for this area.
Yeah,
Okay, so like you say you handle 20 patients a day?
80.
80 patients a day?
Yes.
80 to 100.
Okay, and then looking at the health post, is it like enough, is there enough manpower to handle all this?
Actually, there's a shortage of manpower
Okay.
issue because even the antenatal, it's always busy. So you'll find that we are four staffs. Yeah, that is one clinical officer, one nurse, one AT, and the other one is also a nurse. So two nurses. So find the other one will be at night, the other one day, other one on nights off and so forth. So there's shortage of manpower in short.
Shortage of manpower.
Yeah.
That's quite interesting. So in the case that maybe, like you mentioned something about not being able to treat certain cases and they have to be referred, what's the distance to the next facility where you have to refer your patients?
So our referral facilities are the Teta District Hospital. But due to challenges of transport, when we call for an ambulance, if it's readily available, yes, it's okay. People can go to the theater. But the challenge is when coming back now, clients have to go to Kawe and use the Kawe route. So usually clients prefer going to Kawe than going to Itete because of the geographical location. Yes.
Okay, and what mode of transport do they normally use? Like if they have to come back from
It's public transport.
public transport?
Yes.
Okay. So you talked about the ambulance. How long does it take when you call an ambulance to come and get a patient?
On average, it's 2 to 3 hours.
2 to 3
Yeah,
hours.
and that's if it's within reach. Yeah. Yeah, if it's within, if it's stationed at Iteta, in the next 1 hour, it comes. But if, let's say, we have cases whereby you call for an ambulance here in Momboshi, then someone again from another facility calls for the same ambulance, meaning it will take a bit of time. But yeah, whenever we call for an ambulance, it comes. But there are some constraints that is beyond either us or the people at the hospital. Usually, sometimes it takes 3 hours. Yes.
So in addition to what Mr. Banda said, ambulance most of the times it always come when it's in maternity cases. Most of the times it comes when it's maternity. But general case, it's a big challenge, meaning that the relatives needs to provide the transport for the client to be transferred to the hospital. Sure.
So the thing is, as a district, we have limited transport, which is available, the ambulance facility. So basically, we've prioritized the maternal cases, unlike the general cases.
I understand that you're also on the Virtual Doctors app.
Yes.
Just tell us more about it, like when did you join and how has been the experience so far?
We have joined the Virtual Doctors in 2021.
Okay.
It's 2020? Yeah, 2020. But the experience, I'm saying it's good because when you create the case, you post it to, you create the case and you send it, the doctors are able to respond accordingly and advise you what you're supposed to do at the facility level. And if it means that you or maybe the client need to be referred, they do so accordingly.
Okay.
Sure.
Okay, so are you both on the app? Like, or maybe do you use one app and then you both consult, like when one is not at the facility, somebody has to take over, like how does it work?
Okay, so we're using one app. Yes, we are given one phone, and that's the phone that we are using. When he's not there, we consult from him. Yeah.
Okay, so how's been your
It
experience?
has really been, wow, it has really been of help. Like I mentioned earlier on to say, we are a small facility. Unfortunately, cases do not look at the capacity of your facility. They just come as they are. So when we have a case that needs attention, we consult the virtual doctors, and it's more like you are at a hospital. Yeah, because we are able to have access to the doctor who is stationed at the hospital. And it's just more like you are now at the hospital. You have a hospital at a health post. Yeah. So it has really been much of help to us as a health post.
So you talked about referring cases on the app, and then based on the information that you consult, doctors are able to give you advice. So do you think that is helping you? Is that helping you in terms of maybe the number of referral cases? Are they reduced, or are they still the same, like from your experience now?
Actually, they are reducing. Like before this program came, every client like in blood who came with maybe a baby's breech, in breech position, we are calling ambulance to refer that client. But now that the app is, we have an app, and then we are able to learn, like when you go to Medscape, they will show you the position where you are, how to turn a baby in a position, in a breech presentation, and how to deliver the baby. So actually this app is helping us.
Okay.
Currently we are not referring client who is, or maybe who is in breech position now.
Oh, okay.
Sure.
So even in terms of maybe the scope of like your knowledge, do you think it has also improved, like
Sorry?
the knowledge? Do you think it has helped you expand on the knowledge that you have? Have you acquired more knowledge based on the consultation?
Actually, we really learned more from this app, because I remember the long time ago, I was just reading the basic ultrasound, obstetric ultrasound, without knowing what it is. But now we have mobile abdominal ultrasound, and we are using the same books to operate our ultrasound. Sure.
Okay.
Yeah. So there are some cases that we've consulted from the visual doctors. Yeah. So when you call using the app, you are helped. Yeah. So when you are calling, you have little knowledge about the case, but through the interactions with the doctors, at least we've also benefited as professionals. Yes. So it has really been of help. Sure.
Interesting. What word of advice do you have maybe to somebody who's not yet on the app, or maybe any clinician out there who's not on the service?
Well, basically, I would urge my colleagues, the clinicians, to come on board. Yes, maybe through your organization. Maybe my appeal is maybe you extend this help to other facilities, just as it has been of help to Momboshi Health Post. I feel other colleagues of mine would also want to benefit from the services, because through interactions, like when we meet colleagues from other facilities, they'll ask how we've heard about virtual doctors. I said, yeah, yes. How has it been of help? So we've told them, so they're eager. They're also looking forward to such facilities. Sure.
Thank you very much for being part of this interview. I must say, I've also learned a lot from just this conversation that we've had. I know we interacted maybe via phone, but to come physically and just to see how the facility is and how you've been using the app, I mean, it's quite a great. And I must say, I must commend you for the work that you're doing in the Ministry of Health. It's very good to help people and save lives. I must say, good job well done.
You're welcome.
Thank you.
Thank you.
Yeah, let me also take this opportunity to thank you guys from the virtual doctors for the help that you've rendered to us as a facility. Yes, Mitchell Doctor has really been of help to this facility. And now that we are here physically, we just thought of saying thank you in person. Thank you very much.
So about yourself, Doctor.
Okay, hi everyone, I'm Hannah and I'm an ophthalmologist from England, and I joined the Virtual Doctors in 2020 during lockdown.
Okay, what motivated you to join the Virtual Doctors?
So during lockdown there wasn't that much emergency work for ophthalmology, so I spent a lot of time just at home feeling guilty that I'm not actually doing my work and wondering what I could do to make myself more useful. And I just came across the Virtual Doctors just whilst researching online, and I've done some work in Africa before, particularly in Zambia and in Gambia, and yeah, I just thought it was a really good cause and it was something I thought I could do to contribute, so I signed up.
And how's been your experience so far?
Oh yeah, really good actually, yeah. The interactions I've had with the team have been really good. And coming here, James Ferry was really helpful in organising a visit to this clinic. And yeah, all you guys have been good as well. Although yeah, it took quite a while to get to the clinic today, but I think it's a really good experience to see what challenges that people here face in the clinical offices who are just working in basically the middle of nowhere compared to what we have in the UK. It's given me a much better perspective. So I think when I go back and I'm consulted about different cases, I'll have better understanding about where the patient is, and then how I can best advise them. In terms of the app, the workload is fairly light actually. I only get a few cases. I think it probably depends on what specialty you are. So I'm, as I said, ophthalmology. Then talking to clinical officers here, they tend to get quite a few general cases. We saw one girl with a skin condition. So they clearly need different specialties. So yeah, I would definitely encourage people to sign up to it. Once you get a case, you just basically get an email and then you have 24 hours to respond. I have missed a couple of cases. I think once when I was just before my ophthalmology exams and I didn't see the email. But during those times you can say that you're not available. And when you are available, you just need access to the internet. So you just log in, have a look at the case and respond, and it's generally fairly quick. There's the opportunity to interact further with the clinical officer as well. So I always say to them if they need any more help, if they need, if the treatment advice is not working, or they have any more information they can provide to me, then we can carry on the conversation. Or we just close the case and then I'll wait for the next case. But yeah, I think it's a really good idea and it has a lot of potential to develop further.
Okay. Why should somebody use the service? Like, why should somebody use the app?
What, so the clinical officers here?
Yeah,
So I think, well, I mean, if I was a clinical officer working with even as, ophthalmologist working in a clinic such as this, I would definitely be looking for all the help I can get. I can imagine it must be very difficult to have to deal with whatever comes through the door with very limited resources. So I think this is a really valuable way just to get some specialist advice within a short period. I mean, even in the UK we sometimes struggle to get a specialist opinion. I think, the fact that you're able to get a specialist opinion just by using the app is a very valuable thing and not to be underestimated. I think anything that can help the patient basically and help you to deliver a better service is really good.
Okay. Do you have any words of encouragement to the clinicians or the ones that are using the service?
I think you're doing a great job. I think anyone would struggle to work in this environment and with the resources you have. I would say to keep going, do what you can, don't give up. I think an enjoyment of it as well. As long as try to enjoy what you're doing. Try to each case that you come across, try to understand it and learn. So next time you have a better idea of what to do. And if there's any opportunity, so when I'm consulting the clinician, I'm more than happy to do a bit of teaching and tell them for next time the important things to look out for. And I think as long as you're doing that, you're always learning, then you always do a better job. And at the end of the day, we're all here for the same purpose, right? To help our patients and help them to be healthier, live longer, and enjoy life.
That's about being healthy. All right, thank you very much, Dr. Hannah. It's been a privilege to have you here.
Thank you
for taking the time of your busy schedule to come out, visit the facility. I must say it's really wonderful and it's amazing job that you're doing. Thank you very much.
You too.
All right, that's it from the patient doctor.